I'm Jeffrey Davis, and I'm an orthopedic surgeon here at Andrews Sports Medicine and Orthopedic Center here at St. Vincent's Hospital in Birmingham, Alabama. I was born in Decatur, Alabama. I grew up in Atlanta, graduated from high school there, went to Georgia Tech, and chose to walk on down there and play football. I did get to play in a couple of games my sophomore year, but it was never something that I had a great deal of success at, but it was certainly a great experience for me. I got to play 3 years down there. I went to Medical College of Georgia in Augusta, Georgia. Spent 4 years there. Then when I left medical school, I decided I wanted to be an orthopedic surgeon. So I went to Memphis, to Campbell Clinic, and to the University of Tennessee at Memphis for my internship in general surgery and then for my residency in orthopedic surgery. They wrote the book that's considered the Bible in orthopedic surgeries, Campbell's Operative Orthopedics. It was written by most of the guys that trained me. The Air Force had paid for my schooling in medical school, so I got to choose where I wanted to go to some degree, and I got my third choice, which was Fairchild Air Force Base in Spokane, Washington. But it was a good experience in the Air Force for 4 years. I'm very proud to be here at Andrews Sports Medicine Orthopedic Center. I joined the group in 1995. I've seen a lot of the growth of the group. The culture here has always been about excellence. Dr. Andrews always has been about patient care, patient first. It's always nice to be in a facility and with other physicians that patients have great confidence in. They don't question as much, and that's a huge benefit to me as a practicing physician. I do general orthopedics. At various times I've done just about everything. I limited my practice as I've gotten older to fewer things, from the fingertips to the shoulders, and from the ankles to the hips. If I had an area I focus on, it would probably be hip injuries, hip resurfacing, hip replacement. But I do a lot of knee replacements. I do a lot of shoulder arthroscopic work and shoulder surgery. So I do a little bit of everything, but the thing that I do uniquely is hip resurfacing. The advantages of it over hip replacement is you're conserving bone. You don't alter leg lengths or the mechanics of the hip, and it feels more like a normal hip. And it allows patients to have a very active lifestyle following the procedure. God's been very good to me in terms of the wife I have. We have 5 children. I am a believer in Jesus Christ as my Lord and Savior. In most of the rooms, we have scriptures written on the whiteboards. Most of my patients do that for me. I don't have to do it. They know what my faith is, and so they do it for me. About 2 years ago, I began offering to pray for patients before they go back to surgery, especially the ones here where we're doing inpatients, big cases. And I've been ecstatic about the response. I'd say 90+% of patients are thrilled to have me offer a prayer for them. We often join hands and they pray along with me many times, and it's just been a great experience. It helps me focus, helps remind me that I'm not at this alone,